Good morning, Beth Minot here again, and I'm excited to start our panel on creating smarter systems for health and wellness. This is very much a continuation of the conversation that Chris started with us this morning about how to understand smarter cities, smarter communities, and how to work at scale to improve health and wellness. We're going to look at this from a number of different perspectives, and it's exciting to have the folks here with me who represent not only different forms of partnership with Georgia Tech, but as you will see, different approaches and different challenges in their work. So I have Margaret Wagner-Dahl. She is the Associate Vice President for Information Technology and Analytics at the Georgia Institute of Technology. I have Steve Jarvis, the Innovation Development Director from Anthem Innovation Studio. Both of them had a very long commute of walking from one building to this one. I have Sabrina Jalaw, who is the Executive Director of the Georgia Farmers Market Association. Sorry, I'm going out of order. And then Michelle, who had the longest commute and I guess a very early flight this morning, but coming in from Steelcase. So she's the Director of Healthcare Environments for Steelcase Health. So I want to start by asking each of you to give a longer introduction to yourself, but more importantly, focus on kind of one of the systems that you're working in and your approach to make it smarter for health and wellness. So Margaret, if you could start.
Sure. So Margaret Hall at Georgia Tech, but what I'm going to talk about very specifically is our involvement in the university system of Georgia's well-being process. And so I serve currently on what's called the Total Rewards Steering Committee, which always sounded like some point thing, but it's actually the committee that advises the Board of Regents for the University System of Georgia, which is a very large system across the state with many different kinds of component institutions. Obviously, Georgia Tech, Georgia State, University of Georgia represent your research-intensive R1 type universities, but we have many, many other types of universities and colleges across the state. What we're working on is scaling well-being programs as a mission from the university system for what is 80,000 covered lives. And we have 40,000 employees who have signed up for a USG health plan, and then including their families, it represents about 82,000. So we have just been embarking on rolling out a platform and with some incentives and some penalties. But it's a big experiment, and I think what we will talk about more extensively is the issue of scale and the how do you reach a very diverse demographic, geographic population that has very significant challenges. We are no different than many other large employers in the state. Obesity, diabetes, cancer are huge, expensive issues. But there's more to what we're calling well-being in the traditional sense of prevention, population health management. We actually are looking at a very holistic approach to what is well-being. But the scale and, frankly, the cost drivers as to how to implement this in a meaningful way is the challenge. And I'm just going to ask, so of all the employees in this room, has anybody signed up yet for the well-being challenges? Oh, yay! Yay!
He's a health systems guy. Steve, if you could.
Sure, thanks. Steve Jarvis from Anthem Innovation Studio, right across the way here. It's always great to be in a room with so many smart people, so this is awesome. As my role over in the studio is really, I have a couple of missions. One is to support our business teams who are working on ideas that usually get generated from inside Anthem's business. And those ideas get ideated and shaped and defined and delivered back into the enterprise for execution and ultimate delivery to market. And many times those initiatives involve emerging technologies. So my team supports those initiatives from a technology perspective. The other part of my mission is to actually explore and experiment with emerging technologies, and also to explore potential use cases in healthcare, particularly in the payer space, because Anthem is a health insurance plan. So one of those initiatives I thought I'd talk about today, and that is giving consumers access and control of their health data over their lifetime. Okay, so imagine if you had claims data, benefits information, demographic information about yourself from health plan to health plan. So as you change plans, that data comes with you, okay? And it's not just about access to that data, because that's frankly not all of that useful, but what is useful is what insights can I get from that data, right? So what are my care gaps? What doctor did I see for a particular surgery? What antibiotics have I taken over my lifetime? Answering those kinds of questions. But then it starts to get super interesting when before I get to that, also the control part is, can I take that data and share it? Share it with a provider, maybe some other caregiver, maybe a family member. If I'm elderly and I need somebody to help take care of me, right? How do I share that data? So that's a really important aspect of it, and that's the control part of the data for the consumer. But it starts to get super interesting when you combine health data with non-health data. So what if we had data like weather, financial markets, social media, wearables, IoT devices, right? And start to combine all this data in a meaningful way. Now, instead of just getting answers to questions, maybe I can start applying analytics and machine learning to that data and start to get predictive. And so now I'm able to give the power to the consumer to make better decisions and ultimately lead a healthier life. So.
Thank you, Steve. We're going to get that traffic data too in here. Michelle, please.
Michelle Osmond, as Ben said, I'm the Director of Health Environments for Steelcase Health. By background, I'm a nurse and nurse practitioner. I practiced at Emory and Grady here in Atlanta for about 10 years. Neurocritical care and emergency departments. And it was when I was redoing my ICU over at Emory University Hospital that I thought there was really the important need to have clinicians understand built environment and how it is that the built environment, with all those technologies, interact together to influence the practice of medicine and the practice of nursing and the care of our patients. So I'm actually a graduate of Georgia Tech. I got my doctorate with Craig Zimring here in architecture, culture, and behavior. And so at Steelcase Health, it's my job to really understand and bring to market the understanding of the built environment, and again, those implications for health. So not just in terms of furniture, which I know is how people think about Steelcase when they think about us, but around the interaction of people as they engage with those different objects. Internet of Things is something that is very interesting to us for obvious reasons, because we interact with every part of our world. And so to understand that relationship, and insofar as how we can start to quantify those qualitative measures to understand that relationship to health. So this goes all the way from the hospital, very much on the acute care inpatient side, down to the home, where we know our patients wish to remain and live and stay. Now for us, since we focus on the worker very much so, we really do care about that component of our world. It's the interaction between, again, the healthcare worker, wherever they happen to be. I would love to be able to practice medicine from my home, the way my business banking colleagues have been doing for the past 20 years, and I can hear their boat and the dog in the background while I'm in the hospital. Why can we not do ER triage from anywhere? And in that way, have our own quality of life as well as clinicians. So it tackles multiple levels, from burnout to broader well-being issues, I think, throughout the entire system.
Perfect. Thank you, Michelle. And Sabrina, you're going to bring a real community perspective into this as well.
Absolutely. I'm Sabrina Jalaw. I'm the Executive Director of the Georgia Farmers Market Association. And interestingly enough, I kind of stumbled into this work. I was diagnosed with lupus and was looking for ways to address my health holistically. And so I started shopping at the farmer's market. And one of the first things I realized is that the farmers that I was purchasing the food from did not really know, or they weren't able to really kind of help me bridge the gap between what they were growing and the nutritional value and how it might actually impact and improve my life. So that's kind of how I started to do this work. The goal really for me was to help other consumers know the value of their local food system. And it quickly became clear to me and evident to me that not all communities have local food systems. Not all local food systems are thriving or sustainable. And then, the next step into that, or the deeper dive, was that it wasn't accessible to everyone. And so the work of the association, therefore, has become to improve local food access and to make sure that we are equitable with local food in communities in Georgia.
Terrific. So we had a preliminary phone call and discussions amongst ourselves last week, which generated a ton of questions. So I'm going to try to work through as many of these as we can this morning. In doing so, I'm going to suggest folks that may want to jump in, and then we'll go through a bunch of these quickly. But if it's a burning, you've got something you got to say, then you're on the stage, you wrestle it away from me. So I want to talk, and then maybe it's unfair, I'm going to start with the hardest question. How do we influence people's behavior? Right? This is the brass ring in this space. So Michelle, I want to start with you, and Margaret, maybe chime in because you've got some interesting combinations of approaches. But what is this notion of how we are shaping people's behavior around health and wellness? Because many of the persistent problems that you're addressing, that is the core ingredient.
Sure, and what's so funny about that is you have to understand the antecedent, right? That really is the core issue. Back to the issue of transportation and infant mortality. It's absolutely clear that if the patient cannot interact with their healthcare provider, it's going to be an untoward event. And so I think this also ties really closely into the notion of combining those folks who specialize in technology with arts and sciences, as you were mentioning as well, understanding the psychology and the sociology of these bigger, broader issues. So oftentimes we throw a solution and don't think about that underlying behavior. And fortunately, I think, at least in the medical community, there is so much great research done by my nursing colleagues, my psychologist colleagues, physician colleagues, understanding those underpinnings of how it is you get from point A to point B for the outcome. I think it's there. It's deep within qualitative nursing work. They've been doing this kind of thing forever. It's just about bringing that to scale and making that applicable. Again, making the qualitative quantitative and actionable, I think, is the key determinant. And then, of course, so many of those things we don't quite understand. And I think, to your point, being able to closely gather that data, think, maybe there's this variable out there I really wasn't considering that really is an underpinning that's going to affect my health. Because I don't think we always know ourselves as well as we think we do. And yet also maintaining that understanding of the theoretical model, because if you give me a big enough data set, I can make everything relatable, right? So that's also a key part, I think.
Yeah, and I think absolutely all of the above, but I'm also going to be, as I warned Beth, I'm going to sound a little bit like Debbie Downer here, but okay. Because, the reality is we have a lot of incredible technology to do all kinds of analytics, and we can even make it pretty actionable, and you still can't change people's behavior. You can give them all this incredible information about themselves, about their ecosystem, all kinds of stuff. And so, why is it that you can't sort of change, do the walk for 30 minutes, do the take time out and, center yourself, smell the roses? Why can't you can't figure out that, I really should pay attention to my blood pressure. So I think our challenges with this, and I'm talking really as from the employer role of how do we create this well-being construct for our employees that is going to work. I'm afraid we're still very much at the point of experimenting with a lot of pilots, a lot of carrots, incentives. People, what is one person's carrot is another person's piece of celery, you know? It's very, very difficult. And I think we have to be incredibly realistic about how hard it is to change behavior. And so it's kind of like I really respect what all of you are saying, is to put it on the table, put it in a format that is going to meet the person where they're at, because that's a whole other issue. But what we're seeing with USG is this is the first time we've rolled out an incentive where if people do several activities that can be anything from financial management, because that is a huge stress point in our demographics, our population of employees, financial management, doing a health assessment, doing some sort of physical activity, and then understanding what's vital to you. You can save $100 towards your health premium, and it doesn't sound like a lot, but the research and the psychology is really showing actually it's a pretty significant nudge for people to try and participate. But we don't know. We don't know. So it's a huge. I'm going back to the scale issue. Is that I think there's much that can be done on the one-on-one basis, but then how do you scale it at that system level where you can really, at every pilot that we're doing right now, absolutely has to have very specific measurements so that at the Board of Regents level, we can make a recommendation that this is working to the extent that we should invest in it versus things that we are going to shut down because it's not showing the return. So I think we're still learning a lot.
All right. So I'm going to push further on this scale issue, and scale not only from a business proposition, right? So all of Steelcase or all man tomorrow, 80,000 employees, but also from a diversity issue, right? The distinction of kind of the range of people, for example, within those 80,000, or the diversity of the data, health data plus traffic data plus financial support. So how do you try to design for that scale? And Steve, I'll start with you, but really kind of anyone can jump in on this.
Yeah, so it's a great question. I think that, we're in a huge learning mode on that ourselves, right? One of the problems that we initially encountered in our initiative was we have a huge ecosystem of health plans out there, right? And so how can you possibly aggregate that data together? Number one, the health plans are not incented to do that at all, right? In fact, their data is theirs and they protect it, Anthem included. But yet you want to be able to give it to the consumer. And I don't think that those health plans would object to that. In fact, I think legally they have to give it to you. So, and one of the things we thought was, are there technology enablers? As an example, I'll give this one example as a technology enabler that may help with this, and that is blockchain. Okay, and everybody out there is going to go, oh, blockchain, okay, well, it's just a buzzword. It is a buzzword, but we're actually trying to do something real with it. And we stood up a proof of concept where we were actually able to, in a secure manner, record transactions in a blockchain that simulated individual payers authorizing access to for an individual consumer, and then be able to aggregate that on a personal device such as an iPhone, right? And we actually have a working demonstration of that. So that's just one example of how we're trying to figure out how to solve some of these scale issues. Haven't really tackled the non-health data yet, but that's something definitely that has to be figured out.
I just wanted to just kind of chime in and just kind of add some thoughts from a community perspective and some of the work that we have been doing that has been impactful in terms of helping to. I don't like the idea of changing health behavior, changing behaviors as much as I like the idea of kind of supporting people in their ideas surrounding improving their health and improving their communities. Mm-hmm. So that's how we look at it. And as it relates to meeting people where they are, you know, I kind of feel like that should be viewed as more of like, what resources do we have to support the ideas and the values that a community or an individual or a family has. And so with the Farmers Market Association and just some of the other partners that we work with, we have two programs that we've support that have been extremely successful. One, and you guys may be familiar with it, the prescription RX program that Wholesome Wave offers. It's an incentive-based program, and it's been very, very successful because it's community-based, and the participants are able to kind of determine what are the values surrounding their health and wellness. They decide to meet and exercise together. They are given vouchers to be able to use at the farmers market to redeem for fresh fruits and vegetables depending upon their household size. But I think the success of the program is that the determining factors in each individual group on what they do and how they do it and how they're improving their health and even their goals individually and as a group is determined by the collective. Another example is a program that we just piloted in Georgia. It's a national program offered through Old Ways, and it's called A Taste of African Heritage Cooking. And it's a 6-week program, and it is built on the idea that a community-based facilitator will guide the participants through a culturally relevant cooking course. And losing weight is not emphasized. Changing health outcomes is not discussed. They do take measurements and BMI and weight, all of those kinds of things, but it's really kind of a footnote to the idea of connecting to food, making those changes because culturally it just makes sense. And you're doing it in a setting where you're connecting with your neighbors, with friends, with like-minded people, and the weight loss, the health outcomes, which across the board are significant. Participants lose an average of 6 pounds over the 6 weeks. Blood pressure changes significantly for the better. So the improvements are there, but they're just not emphasized, if that makes sense. So I just thought that I would add that. I don't know that that kind of fits into the technology space as well in terms of, creating solutions through technology, but definitely in terms of practical implication and making changes and impact on a community level, we've seen tremendous benefits.
I think that it does. I think that it does simply because when you are, on the abstract level, what you're demonstrating is personalization.
Right.
And we do this with our patients. I come to you wherever you are and help you in your goals.
Right.
In that same way, as you pointed out, what is a carrot for some is a stick for the other. What may impact each individual patient may be different, and I think technology would allow you to personalize each one of your initiatives to help them along that particular path.
I'm just thinking and wanted to share this with you because there's a connection here, but one of the pilot programs that we're doing through this program is called Naturally Slim, and when we rolled out the site, we allowed people that came in and did the health assessment part of committing to the well-being incentive could also elect to be approved for the Naturally Slim project. And we really weren't sure if it would be of interest because it is a very technology-based program, but it's doing exactly what you're talking about because it is not emphasizing weight loss. It's not talking about that. What it is about how you look at food, very much about a cultural context. It's just, and we thought we'd be lucky if we got 1,000 people to maybe sign up. That was sort of the platform for the vendor to do the program. But we had 2,000 applications, which showed us across the state, and it showed us people are looking for different ways that are not your typical yo-yo, at more of that holistic approach. But we deliver all of that through webinar, through content, through technology. So, and I wanted to share with you, and I looked back at how we were positioning this. Some of the research that we looked at, it made very clear statements about if you can do one thing how you look at cooking will have the greatest impact on your health and well-being. Just that.
Agreed.
So I want to take this conversation and push a little further because we've talked about the engineers and the scientists in the room, and we've actually talked about humanities, social scientists, but we also have a design community in the room. And Michelle, we'll start with you because I know you can speak to this. But what are the design best practices, insights? What are the different ways of creating features in the system? And I know you've looked at this from a universal design perspective as well. How do we bring that tool and skill set into this conversation?
Well, first of all, I don't know that I will have all these answers, of course, but I think just a small point there that I think that every problem is a design problem, and I don't know that at least in medicine we've really embraced the notion of design in our work. We talk about study design, but that's a very different animal, right? And we don't, I think, at least we haven't traditionally really understood the need of the user from an insights perspective, from a human-centered design perspective. And that is desperately needed in this conversation. I think the fact that we're even talking about this right now illustrates the fact that it's clearly moved its way into medical schools now, Dell Institute for Health. We see it in Philadelphia. It's really merging into even the practice of medicine such that doctors are starting to explore health and wellness from a human-centered design perspective, even taking their fellowship research year in human-centered design rather than basic science. So I think that the insights are with the methodology from a human-centered design perspective are critical in this case because they are personalized, because they are cultural, because they are contextual. That is the fundamental underpinning, I think, of design.
Yeah, I would add that, we don't do anything without involving users. I mean, you just we don't do technology for technology's sake. We don't start with technology and then look for a problem to solve. We start with a problem, right? We try to identify what those personas are and then actually do empathy interviews. We actually bring people in and we talk to them, right? Because that's the only way you really know, right? And put stuff in front of them and see how they react. And it's so important, yeah.
Sabrina, can you talk a little bit also, because I know part of the partnership is on universal design, but I want to understand that.
Well, and I'm still learning, but I'm really excited because Jenny just walked in from Serve, Learn, Sustain, and she's been introducing us to these just brilliant concepts on how we can improve and support each other, improve farmers markets and support each other in local food, improving local food access in general. And she introduced me to John Hirsch, who brought a team of students into our farmers markets and really kind of opened our eyes on how we can make changes and adjustments in the farmers market design that can make local food more accessible, things that we had not considered. Because honestly, at first, when we started talking about partnering with Georgia Tech on any level, I'm thinking farmers and market managers are like the most low-tech people you can imagine. And we can't even get them to respond to our emails. So we really didn't have an understanding of how this might work. But just thinking about even the way that the market is set up, providing walking routes that are, make the market more accessible by foot for those that, maybe don't have transportation issues, maybe have mobility issues, addressing things like water stations and, protecting people from the elements, particularly the elderly. These are things that we know should be considered, but we didn't really have a framework or a structure to kind of to fit them into the market. So it's been really eye-opening for us, and I think that there's a lot more that we can do in that space.
Terrific. So we've dug in really around design and personalization and kind of meeting people where they are, and now we go back to that hard question of scale and outcomes. So how do you pull all those pieces together, but then have a scalable approach where you can have, how are you creating those measurable outcomes that allows you to inform your work and then justify the investment in the work? Anyone want to go first?
We're all like, we don't want to touch
Okay.
I think In the case of USG, it is really, you can imagine, it's really complicated because you've got different health plans, you've got different, I guess the real overarching issue is this is relatively new to the university system of Georgia to really try and put in this kind of infrastructure. We haven't done that before. We've kind of hauled in the insurance plans and said, where are the problems? Tell us the top spends. What do we need to do? What are you going to do? We get into the negotiation. But the idea of well-being, prevention, getting on top of these things before it becomes a problem is relatively new. So I would say right now we are really still creating the infrastructure. So Truven, IBM, Watson, the insurance providers that we use, it is really still sorting out what is the best data to track, how are we doing it. We were very deliberate about choosing a vendor for this well-being platform, Redbrick, because they've had a lot of experience with how to set that infrastructure up and pull data interoperably from a lot of different sources. But to answer your question, we don't know yet.
Okay. Michelle, you're leading a business unit in this. How do you translate all this into product offerings?
Sure.
Not just furniture,
Sure.
but products that are with partnerships with your customers and clients.
I think we're always looking for what the outcome is of interest to our customer, right? And so that is very medically defined and increasingly wellness defined, right? So looking at that and working backwards, and I can't say this enough, understanding the theoretical model that's going to arrive you at that point. I know we love big data, and again, I think that that's very valuable, and I'm interested in making sense of that data so that we can actually take action on it. But understanding all those interrelated systemic parts so that we can tackle the question. We view ourselves as, so in medicine we talk about structure, process, outcome, non-obedience, classic model. What is the structure that will affect the process, that will affect the outcome? So if we can figure out what outcome we want, and I would argue this is potentially a very personalized thing that is affected by my payer, whatever characteristic you give me, so there's that piece right there. And then designing the process that we want to get to arrive there. And that's where I think design is a big part to play. What is that process? And then for Steelcase, what we try to focus on, okay, if I know what this process is, I can design supportive elements to help me achieve that, to afford that, to make it, from a human factors perspective, how can I make it easy for you to do the thing you already know you want to do, such that it becomes natural? Which is why I'm so interested, for example, in putting clinics in gas stations. That is where my patients at Grady are going for food. I know it.
Get to the gas station.
Yeah, I know it. That's where they're going. That I would love to see us put clinics in those sorts of places. Not at Emory University Hospital. It's too difficult to get there. But that just changes the way you look at it, and it becomes a city planning issue without a doubt. I was so delighted to hear your talk because where we live, that is of course the environment on steroids. That is it, right? The smart city.
Yeah, I think, going back to the whole personalization and technology thing, I think those things are absolutely we have to figure out how to get those things to come together, and not just in a way, and in a way where the technology is not an impediment, because I think so many times the technology gets in the way. Sitting right here right now, my watch is vibrating that crap out of my arm. Somebody's calling me. Well, I don't want that now, right? So how do we figure out how to make it into an integral part of the way we live, the way we want to live, the way we're comfortable living, whether it's, how I commute back and forth to work, or, where I go to shop for my food, or the schools my kids go to. It's trying to figure that out. And I think that's what, we try to, where we are in the studio, we try to, figure out those kinds of things, because that's when it gets really interesting, where the disruption happens and you really get impactful things by taking advantage, of course, of technology and stuff. But you really have to look at that whole picture, or it just doesn't work. So.
All right, so what I want to do now, this has been terrific, so I'm going to give you guys a softball question that you'll enjoy, but you have to answer briefly, because I want to queue up for some questions from the audience, and then you already know what my last question is going to be. So the fun question is, it could be technology, it could be approach, it could be more about the gas stations. What's something that you're really excited about that's on the horizon that's allowing you to do things that you weren't able to potentially explore in the future? And I know Steve was ready for this one, so we'll start with you.
Oh boy.
As I said, it could be technology, but it doesn't have to be.
Yeah, I guess since I'm a technology guy, I'll stick with the technology. It's where my comfort level is. I think for us, one of the things that's super interesting and I think can be a big disruption also is the whole world of digital assistants and natural language processing. So, we've done a lot of experimentation with digital assistants, and those are becoming more commonplace, right? Lots of folks have, Amazon Alexa in their home or a Google Home or whatever. And it's not that interface so much as the technology behind it that gets me really excited. Things like applying NLP in maybe a provider's exam room to help the doctor with his encounter with a patient so that they're not busy, again, fiddling around with the technology, right? When I go see my doctor, she's sitting in front of a terminal and a keyboard, and she's doing this, right? She's talking to me and typing at the same time. I'm pretty sure that she would rather just talk to me, and I'm pretty sure I would rather that be the case as well. So what can we do to sort of help that? I think, technology, I think, could be an answer, at least partially, and so that's one thing that's kind of cool.
The technology innovations to get technology out of the way.
Exactly, yes.
Exactly.
Any other responses here? Something you're very excited about?
Well, we are super excited. We are running our very first Fresh Stop Market pilot, and we're excited about it because it's a hybrid CSA farmers market model that addresses food access in a very creative way. We offer a share of the harvest, a weekly share to the community on a sliding scale, and that sliding scale is self-determined. So we are not, you don't have to, we are not going and checking your income. We feel like if you want fresh produce and you feel that you need to pay it at a different price point, we are willing to give it to you at that price point. So we're very excited about that. We're also excited because we are able, through this model, to guarantee payment to farmers up front. So we are working with farmers, helping them to forecast the food that they'll be growing for each individual market. And so it kind of takes the risk away from the farmer, which is what oftentimes makes markets not successful, is that farmers are really kind of nervous about whether or not they're going to sell on a weekly basis. So because we've taken that kind of component out of it, we guarantee the sale. We guarantee both the food in the community, the sale to the farmer, and we offer it at a sliding scale. And so we're super excited.
Great, meeting people where they are in multiple ways.
Absolutely.
That's terrific. Any more? We're going to go to the audience.
Just very quickly,
Okay.
like you, I'm very excited about offloading my clinician colleagues. Burnout rates are astronomical. These are smart people that don't have to go into medicine, don't have to give up their nights and weekends and holidays. And so that technology is existing, and we in Steelcase are having the opportunity to really explore what that relationship is, to design that relationship. Telemedicine, I think, is one of our number one things we're very excited about going forward. Insofar as patients want to be speaking with their doctor in their home. I'm super curious, for example, about, we're taught how to engage with the patient. How do I maintain that through a screen? I find that really compelling, since we know that the majority of what is wrong with the patient, I can discern from the conversation, not from the exam. So given that, how can we use technology to enhance communication? And as I always say, I want it there when I want it and not there when I don't. That is the golden nugget, I think.